My talk relates to the section on the application form that asks about your knowledge mobilization, your dissemination, and the likely impact of your research. Now, dissemination, research outputs and outcomes, and the impact of your research may seem in the distant future, but you will be asked to detail this in your grant application. So this quote is from Chris Whitty, who until 2021 had overall responsibility for the NIHR. So think about how you're going to get your research findings to the people who need to use them. From the onset, talk to those who will be interested in your research and can enable you to achieve impact. Also, talk to those who may block you. So talk to patient groups, talk to gatekeepers who may have huge influence, although low interest in your research, but who can ultimately open doors for you to those who are the most likely to benefit from your research. So this could be hard to reach individuals. Now I'm referring to the NIHR, but it will be relevant to other funding bodies. So as part of your NIHR application, you will need to explain these. Think of who you will be disseminating your research findings to, and how do you plan to get the information across to them? What do you think your research outputs will be, and what is their likely impact on patients, the NHS, and the public? Funders, they do understand the impact of research takes time. For all the NIHR funding streams, these are the assessment criteria related to knowledge mobilization, dissemination, and impact. Now, all the web links in this presentation are in your PDF handout after my slides. There is variability in what is meant by terms like dissemination, knowledge mobilization, and impact, but are discussed in the context of the NIHR. So dissemination is you and your research team, including PPI representatives, getting your research findings to your planned audience. So using defined channels and following your planned communication strategy. That is to people who need to know about your research, so your knowledge users. Knowledge mobilization is a process that paves the way to impact through collaboration with key stakeholders throughout your research. So when designing your research, you need to plan how to share it with people who can use it to effect change. So describe how you plan to achieve your intended outcomes and impact as part of your knowledge mobilization plan. So you should consider who your key stakeholders and knowledge users are, what knowledge mobilization activities you will use to actively engage with your stakeholders and knowledge users to maximize your intended research outcomes and impact. So your research needs to reach those who can share and integrate knowledge to improve practice and services. So the ultimate aim is to have real-world impact. So making plans for knowledge mobilization will ensure your research reaches the people who can improve practice and services and maximize impact. So a challenge for the research community is that effective interventions should not take 16 years between receiving funding and realizing the health gain impact in wider clinical practice. So implementation is the practical process of integrating new products or services into everyday practice and policy. So this link here provides some insight into theories, models, and frameworks to help you systematically plan for implementation. When talking about impact, it is the change the research will make. So the pathway to impact needs planning using the processes of knowledge mobilization and dissemination. So the impact of research is rarely maximized. Research findings often do not reach the people who can act on them, and they are not always used in practice. Outcomes are considered changes or findings that occur because of your research activities. They could include improvements in your research participants' quality of life, workforce changes, or economic benefits. These can be achieved within the lifetime of a funding award. Impact is the longer-term outcome of your research. It includes real-world changes at a personal, organisation, or a societal level. You can use a schematic diagram to describe the logic underpinning how your research will achieve its intended outputs, outcomes, and impact. Now, this diagram here is an example of a logic model from the NIHR research program for social care. It is important to initially think of what the impact of your research may be. These are common words used by organisations when they define impact. Both these definitions refer to research impact extending beyond academia and emphasise the contribution of research to society and the economy. So the vision of the NIHR is for the research to improve the health and wealth of the nation. Impact is the longer-term outcome of your research. It is the provable benefit of research. It is broadly defined as the contribution, effect, either positive or negative, or benefit that research makes to knowledge, people's health and well-being, how health and care are delivered, and ultimately the benefits to our society and economy. Impact is a change backed up by the evidence, making things different, better, safer. It doesn't have to be big, just meaningful. And generating impact from research takes time and often compromises a series of small incremental changes. More research may be required before change can happen. So impact is a term for the change or benefits. Knowledge mobilisation is the process that gets you there and is made up of activities like engagement, dissemination, and commercialisation. So impact includes these benefits, including any commercial return that could contribute to economic growth. Think about the wide range of people who might be interested in your research or your research findings. Map each impact goal to who you think will benefit, and then identify the specific engagement activity that is needed to enable you to deliver the benefit to the people or groups that you've included. And how will you measure the broader societal and economic impacts resulting from research? So generating meaningful research impact requires you to have conversations even before the design stage of your research with the people who are likely to be interested in your research or use the research from the very beginning. So consider how to engage with and involve research users at every stage of the research process. As well as patients, carers, and members of the public, research users may include commissioners, voluntary sector professionals, managers, clinicians of various backgrounds, and anyone else who is crucial if the intended change is to happen within practice, policy making, third sector, or private sector organisations. So engaging with research users and identifying potential impacts from the onset will help you to plan processes by which your research may, directly or indirectly, lead to change. So planning includes considering the kinds of impact you are hoping to achieve, such as what might change, for whom, to what extent, and when. Your engagement and impact plan should outline how you will engage with research users to deliver impact from your research. So have a look at this cartoon. You'll need to describe the main knowledge or outputs from your research and how they will be presented, disseminated, and used. So set aside some time to think of an effective plan to communicate and disseminate your research findings to others, and how this will maximise the potential impact of the proposed research. These web links will help you do this, but what follows is a summary focusing on the NIHR, so always check the funding body guidance. Think carefully about the objectives of your dissemination and engagement. They may change throughout the course of a research study. For example, at the beginning of your study, you may wish to engage with audiences that can help shape your research and approach. Once your findings are available, your audience may focus and expand to include policymakers, practitioners, or members of the public with the hope to raise awareness and change in practice. So your objectives should avoid focusing on the output, for example, to produce a blog, or concentrate on the desired impact. For example, raise awareness of the findings to clinicians and health policymakers, leading to change in practice. But be realistic and pragmatic. A feasibility study is unlikely to change practice, but you can use the results to raise awareness and gain support from other centres to take part in a future definitive trial. It seems obvious, but the better you know your audiences, the more you can tailor your communications to their specific interests and needs. Then the more effective your communication will be. When and how will you engage with your audience? Where do they get their information from? It might be through a support group, conferences, journals, email, websites, blogs, and social media. Try to stay connected with your audiences throughout the research. Ideally, involve them from the planning stage through to dissemination of your research findings. This will help to create a waiting audience for your research outputs and then hopefully influence the impact of your research. You will need to align with the NIHR research inclusion requirements to consider and mitigate, where possible, barriers to co-working and engagement. You could map out the people and groups you've identified on a stakeholder grid, plotting interest against influence from low to high. It will help you understand how much influence each group has on the interpretation, dissemination, and implementation of your research, and their interest in your research, progress and findings, and in the facilitating its uptake. So the stakeholders who are high interest and high influence should be a priority focus. Those with high interest and low influence should be kept informed. Those with low interest and high influence should be kept satisfied, and minimal effort should be spent on those with low interest and low influence. Look, the NIHR is accountable to the Department of Health and Social Care, and it needs evidence that your research will make a difference to the government, to both the government and to society in general. So the NIHR and other funders need to be able to demonstrate they're good custodians of public funds to ensure continued investment of public spending into research. There's not one single definition of impact, but ultimately for the NIHR, impact is about making meaningful difference to people's lives through research. So describe the impacts you aim to achieve as a direct result of the project. Consider how any smaller, more immediate effects may mature over time into larger scale or more significant effects, and the steps by which this may be achieved. Impacts may include, but are not restricted to, these here. As far as possible, indicate anticipated timescales for any benefits and a quantitative estimate of the scale. And in 2024, the NIHR released these very useful short animations on impact. Some impact from research will happen by chance if you don't do anything and just wait. But the full potential of your research may not be realised. Knowledge mobilisation is a process to get your research out to those who need it most. It broadly encompasses dissemination, knowledge transfer, and knowledge exchange. You'll need to disseminate your research and its findings to those who need it most. Impact is the outcome. Effective dissemination is about you getting your research findings to people who can make use of them, and how this will maximise the potential benefit and impact of the research. There is an expectation that results are published, but the NIHR appreciate this might not always be possible due to IP restrictions. So remember to consider other dissemination activities and request funding for these. Dissemination in the past was typically about doing the research, writing a paper, and presenting at a conference. Journal articles are an important output, but it needs to be more than just targeting research audiences. Your dissemination plan will still, however, need to be realistic. For a feasibility or an early clinical study, for example, it is not expected to be extensive. Think about the main message from your research findings that you want to disseminate. How can you frame this message so it will have a particular meaning and importance to your target audience? To achieve this, use the right balance or the right language and focus on the possible impact of your research on a clinician's clinical practice or a patient's daily life. Produce targeted outputs that are in appropriate format for the user. Consider a range of tailored outputs for each audience. It's also important to include details of how you will share the progress and findings of your research with study participants. term outputs refers to any tangible product of the research. So what do you intend to produce from your research? The NIHR has a broad definition of what constitutes an output. They can be written, audio-visual, electronic, or verbally presented. This slide here lists a host of outputs to consider. So think of the potential outcomes of these. For impact, simply making outputs available will be insufficient. You need to consider and outline the process you will use to identify and engage with key parties. The format of dissemination could include any of these examples. The link below shows how some examples of webinars that you could consider. So describe how your outputs will enter the health and care system or wider society. Where possible, consider how the work will be adopted and implemented longer term. As the outputs from your research are likely to be commercial, describe the proposed route to market or how you plan on developing this. Describe who is needed to take it forward and the relationship you have with these parties. Consider what further funding or support may be needed at the end of the project to maximise impact. What are the possible barriers for further research, development, adoption and implementation? There could be issues around intellectual property, such as copyright and patents, or possibly some regulatory hurdles. Describe the difficulties which may be faced in generating impact from your research. These may be difficulties you will face yourself, or are there likely to be challenges faced by clinicians to implement the findings? What are the challenges for getting your research implemented in terms of acceptability, accessibility, and feasibility? How will you address these? Consider suitable timings for your dissemination and for sharing interim findings, if it's possible. What resources will you need to deliver your dissemination plan and ultimately to maximise the impact of your research? Include costing for this in your application. Think about the expertise in your team and whether you need additional help for dissemination. Could you benefit from attending a course on dissemination? And if so, put funding in for this. Would you benefit from liaising with the NIHR or the institution's press team to send out a press release when you receive funding at the start of a clinical trial and when you publish? The University of Liverpool recently sent out this press release related to an eye-for-eye project, funding project of a novel new technology. It was picked up by other news outlets. Patients and public should be involved in research from the design to dissemination of the research findings, so engage with them early. They are powerful voices. They are likely to be good advocates for your research. They should be involved in the planning and preparation for dissemination. So as part of the research costing, consider including training of PPI members in public speaking. There could be current, cultural, and political issues you need to consider. Think of how your dissemination might be perceived by different groups. Think about what the risks are to your dissemination plan, such as intellectual property issues. If necessary, seek advice before dissemination from your funder or a university or hospital if they're involved. What might be the most effective way for you to communicate your message to your target audience? For example, your own study website, social media, charity websites, a dissemination event. Try to connect with people in your audience who can be an advocate for your findings. Have a read of this cartoon. These are the download statistics for my PhD from King's College London, Digital Library between August 2014 and November 22. Unfortunately, they don't appear to give the statistics anymore, so I can't update. But I had no dissemination plan, and during this 8.5-year period, there were 170 downloads. Now, contrast this to, I wrote this theme review for the NIHR in 2018. The then Dissemination Centre and I created a structured dissemination plan and the theme review was downloaded over 15,000 times in just over 1 year. This, however, pales into insignificance when my middle daughter made a short TikTok video about basically nothing that had 1 million hits in just over 1 day and 2 million in a week. This just demonstrates the potential power and reach of social media. As said, social media can be a tool to help you engage with patients, researchers and funders. Be clear about the message you want to say and obviously be careful with the content of your message. Social media can direct people to your website. Consider a blog of your article. Consider a podcast. Consider a YouTube video when your article is published or your research findings are available. NIHR TV gives examples of videos about research findings, as well as lots more resources of interest. You can see that the 2025 NIHR Impact Prizes can be found here. This was one of the Impact Prizes that Mike mentioned earlier as well. It is an example of Cancer Research UK, Innovate UK, NHS England, Cancer Alliance and the Medical Research Council, with infrastructure support from the NIHR, Cambridge Biomedical Research Centre and the Experimental Cancer Medicine Centre, supporting technological innovation developed at the University of Cambridge. So this research involved finding a commercial partner, which was a large health technology company. These next 2 slides give you links to lots of resources that detail how to communicate your research to help influence and impact. Within them, you'll find lots of other links to resources. The Research Fish 2024 data tells you what the NIHR is interested in when it reports the outputs, outcomes, and impacts of NIHR research. The NIHR Impact Prizes for 2025 celebrate researchers whose work has transformed people's lives or promoted economic growth. They include examples of impactful innovation like the one I've just shown you. It will be worth you monitoring Impact Prizes over future years. These are from the NIHR, Eye for Eye, frequently asked questions. You need to send a clear message about the project and its likely outcome, and applicants are expected to have an NHS or social care adoption strategy. In addition to benefiting the wider health and care system, the NIHR understands that companies might additionally intend to commercialise their top technology directly to consumers and internationally. So applicants will need to indicate the broader commercial picture of your company, the likely route to market, and the strategy for NHS uptake. The NIHR is eager to support the exploitation of products or treatments to ensure patient benefit. For examples of what you might be expected to write in the anticipated impact and the dissemination part of this scientific abstract, you can search this NIHR Funding Awards web link. I did an advanced search for Eye for Eye from the 1st of January 2025, and there are 56 funded projects. You can open those whereas SME was the contracting organisation, and then open the abstract and you can find examples of summaries. This is from the study on the previous slide. It's only the summary containing the abstract, so the application itself will be in more detail, but there's examples like this will give you some insight into what information is expected. Don't know why I'm there. So remember that effective dissemination is about you getting the findings of your research to the people who can make use of them without delay. Remember to ask for funding to do this as part of your grant application. If you're doing an early small-scale study, then your dissemination plan is not expected to be extensive, as the results are likely to be a way off patient benefit. But what is your longer-term vision and your trajectory to patient benefit? Explain how the findings from your research will be shared with or disseminated to others, and how this will maximise the potential for impact of the proposed research. And think of anyone else who can shift your research results into practice to result in a meaningful difference to people's lives.